Good afternoon, everyone, and welcome to this 13th Key Populations Community of Practice webinar. It's a pleasure to have you with us today. My name is Suad Orhan. I'm Program Officer with the UNAIDS Prevention Team at UNAIDS Global Center. Before we begin, just a quick note on language interpretation. So this session offers simultaneous interpretation in English, French, Portuguese, Spanish, and Russian. To select your preferred language, please click on the interpretation globe icon at the bottom of your Zoom screen and then choose the language you want. So now let me briefly remind everyone what this community of practice is about. This community of practice was established to foster peer learning, knowledge exchange, and collaboration among countries and partners working on key population HIV prevention. It is part of the global HIV prevention coalition's capacity strengthening efforts, implemented in partnership with the South-to-South HIV Prevention Learning Network, which is led by Genesis Analytics and the University of Manitoba. It brings together national program managers, key population networks, civil society leaders, donors, and UN partners, all working together to share experiences and strengthen HIV prevention for key populations. Each community of practice webinar focuses on a different theme, and today's, our 13th webinar, focuses on optimizing intervention with young people from key populations. Today's focus on young key populations is deliberate and deeply needed. Globally, more than half of all new HIV infections occur among key populations and their sexual partners. And young people within these groups are particularly vulnerable. They face multiple intersecting challenges, including stigma, discrimination, criminalisation, violence, and economic insecurity, all of which make it harder for them to protect themselves or access HIV services. They're often invisible in both key population and adolescent health programs, and their specific needs go unmet. Also, in the current funding landscape, with growing uncertainty about future donor support, there is a real concern that these young populations will be missed out if we're not intentional about including them. Yet evidence shows that investing in young key populations is not only a moral imperative, it's also one of the most cost-effective ways to reduce new HIV infections and sustain epidemic control. So our objectives today are to deepen our understanding of what makes HIV programs for young key populations effective and sustainable, to explore practical best practice examples from countries and partners, and highlight collective actions to ensure young key populations are meaningfully involved in shaping and benefiting from the HIV response. To set the scene, we'll start by looking at the latest global guidance and implementation tools for programming with young key populations. And here is my pleasure to introduce Mr. Matteo Casolaro from the Global Fund. Matteo has been closely involved in advancing HIV prevention programming for key populations, particularly in ensuring that financing and implementation frameworks support scalable, sustainable, and trusted service models. He will present the Global HIV Prevention Coalition's new guidance on planning and managing HIV programs with key populations, which introduces the concept of the Trusted Access Platform. This approach provides a practical way for countries to plan, manage, and deliver services so that key populations, including young key populations, can safely and confidently access prevention and treatment through trusted networks of community-based and facility-based actors. Matteo, the floor is yours.
Thank you so much, Suad, and I hope you can see me and hear me well. So my name is Matteo. I work at the Global Fund as a key population advisor. And it really is a great pleasure to be here with you. I just wanted to extend my thanks to the whole SSLN team, but also to the whole Global HIV Prevention Coalition, particularly to colleagues at UNAIDS, Clemens, Helen Marie and Aurea, who together with the Global Fund and other partners have all been working on updating this global guidance on planning and managing HIV programs with key populations. As I said, it's an update of existing guidance that was published in 2020. And now, because 5 years have passed, we thought it was a good time to give it an update. So if we go to the next slide, I'll start getting into it, and this is how I'll be spending the next 10 minutes. So what is this guidance about? So what we know that key populations are disproportionately affected by HIV practically in every part of the world, and we also know why, right? There are factors like behavioral, social, legal, structural factors that really limit access to services and other essential services that key populations need to be able to conduct healthy lives, to be really for their own well-being. Now, the provision of health services to key populations as much as possible has to take into consideration the existence of these factors. And for this reason, we are trying to plan the health service provision to overcome these barriers, right? So now, one way that we're trying to overcome it is presented in this guidance, which is using what we call a trusted access platform approach, which is basically an approach that acknowledges fully that to be effective, key populations need to trust the service that is being provided to them, but also the person who is providing it to them, the service provider, right? And if we go to the next slide, I'll go a little bit deeper into this concept. So actually, before going to that, it may be important to say that it's not a standalone document, right? This guidance is fully based on a number of other documents, primarily the WHO guidelines on HIV, viral hepatitis, and STI prevention, diagnosis, and treatment and care for key populations, which gives us all the evidence that we need to be able to plan services and to the right packages of services for each of these different populations, including young key population, right? Also, it builds on very, very important and useful implementation tools for key populations that are very specific to each of the 4 key populations discussed in the guidance document. And then obviously, there is this particular guidance, which on top of these other evidence-based documents provides a bit of a reflection on how we can plan and design and adapt key populations programs so that they achieve scale in a sustainable way. Next slide, please. So again, what is a trusted access platform approach, right? So first of all, as I said, it's an approach that ensures that members of key populations can access HIV prevention, testing, and treatment services, and that they can do so in a safe way, because more and more it's becoming important that we look at these aspects of safety and security when we provide services. It also recognizes that services can be delivered through multiple modalities and in different ways. And you can see in the map on the right-hand side that there are already some elements of service provision. You see clinical services, you see safe spaces, you see peer education, right, as one of the elements. And I'll go a little bit more into that later on. Now, all of these different ways of providing services can be thought as a platform, really. A platform that then will be adapted based on the country, based on the local context, based on the type of population, right? One important thing is that it's not just one single way of providing services. It's really a ways of mixing and combining these different service delivery models in an optimal way. If we go to the next slide, I can also give you a bit of an idea of what type of content is in the guidance. So this document is divided in 2 big parts. Part 1 discusses how we build trusted access platforms and includes, foundational concept as how do, what do we mean with a key population access platform? What are the key elements of it? How do we plan and adapt it based on a number of considerations, structural, but also resources that we have? And then there's a number of annexes at the end of the document that give cost benchmarkings for different type of services, but also for different type of roles that are needed to build the platforms. Also the type of roles and responsibilities that different actors can have, and provides a bit of maturity framework, if you like, for the different type of key populations programs. The audience for part 1 is particularly local level implementers and managers, including your community-led organization, your community-based organization, but also healthcare providers. Part 2 instead discusses how do we make sure that when we plan these platforms, we plan thinking about how do we expand the coverage, how do we scale services in a way that is also achieving impact and that is sustainable. So we discuss aspects like population size estimates, how to update them, how to do programmatic mapping, There's also an important element of monitoring if we are providing services to the right people at the right frequency, but also if people themselves are using services. So monitoring the outcomes of what we do. Also the aspect of community-led monitoring and how important it is for communities to monitor services. How do we strengthen capacities, but also how do we sustain programs for a lasting impact? Now, part two speaks more, if you like, to national level strategic decision makers, including members of key populations and the people that are being responsible for allocating the resources. If we move to the next slide, we can then go into the key elements of a trusted access platform. And you can see them all listed in that nice colored wheel at the right-hand side of your screen. Now, what is one key thing when you think about all these different elements is that they need to be, first of all, trusted. So all of the providers need to be trusted by key populations, but also they need to come together as one. It means that also there need to be proper referral linkages between all of these services, really to be thought as one platform where services can be provided. Now you see them listed there, but just to go through them with you, there's, in terms of key elements, we're looking at peer outreach, online and virtual programming, community safe spaces, also known as drop-in centers, health facilities that need to be KP competent, right? Mobile clinics, but also other forms, new forms of making sure the services can reach the populations like pharmacies, kiosks, and even in certain contexts, vending machines. Now, let's go to the next slide, and I can tell you a bit more about how we can then plan and adapt the population trusted access platforms. So as I said, very, very important is when we start off planning and designing key populations programs is the aspect of knowing your local context, right? And what does that mean? Well, I need to know the epidemiology of the area in which I'm going to implement, the size of key populations, and where, how they're accessing services right now. Also need to know specifically where, in my neighborhood, where do key population meet and who do they trust when they need services? Do they go to a particular pharmacy to access condoms or lubricants? Where do they go when they have an STI? Who do they trust among local service providers? Because it's starting from these people that I want to start building my platform. Also very important is to consider the enabling environment, or how enabling the environment is. For instance, are there laws or policies that restrict access for key populations to services, or are there laws that enable that access? Thinking about laws that criminalize key populations, those limit access. So what can I do? What my program should do to reduce those barriers? Very, very important also how much funding we have to implement our program, both from external donors, but also domestic money, right, to do and implement these programs. And also very, very important to consider the variations within each key populations, variations such as age, language, migration status, but also preferences that key populations may have for online versus in-person services, for instance. So now the way you combine all these different elements will create a different design for your program. And now with the last two slides, I want to show you some examples that could be possible. If you go to the next slide. So here you see, it's a bit of a busy slide, but we'll take it little by little. So we'll start from the bottom. And you see there is a long red arrow pointing right. So at the left-hand side, you see fewer available resources. And as we move along that arrow, we go to the right, or we have more resources to implement our programs. Now here you see how the different elements that I was talking about earlier can be stacked on one another depending on the resources you have. So now one thing to say in pink is that we can never do without interventions that address the enabling environment, that try to reduce those barriers I was talking about earlier. And also we should always have investments to engage communities in the design of these programs, in the monitoring of these programs, and also to build their capacity throughout. So these are the investments that we're saying are a bit foundational. We can't do without. Also, no matter how little or more resources we have. And the same thing we are saying for having KP competent pharmacies, for instance, making sure that we leverage the existence of pharmacies that are trusted by key populations to provide services. Why not? But on top of that, facilities. Again, we need to make sure that our facilities are trusted by key populations, that we make them KP competent. So the staff has the right level of friendliness to key populations, that do not stigmatize people, but also that they can provide quality care to key populations. And again, one other intervention that we say should always be there no matter what is the peer-led outreach in virtual spaces. That's also something that should always be there. Now, as we move to the right, you see that we are adding some other key elements. For instance, we're saying peer-led outreach in physical settings comes pretty soon along the arrow. But then as we keep on going, you see we're adding peer navigation services or additional online services like e-pharmacies or counseling, and then up to vending machines, differentiated co-located services for KPs, drop-in centers, and at the very top, mobile clinics and dedicated KP clinical sites, which we think should be available in context where we have enough resources to afford to have the full range of services. Now, in this one last slide, you see that it's pretty much the same, but what has changed is the arrow at the bottom. Here we're showing you not so much the available, how much resources we have, but what is the vulnerability of key populations towards HIV. And you see that as vulnerability increases, the more and more and more we should try to add on different key elements. And I'm going to stop here, hoping that I have respected the time I was given. Thank you so much.
Thanks so much, Matteo, for that very clear and forward-looking presentation. You've actually given us an excellent overview of how the Trusted Access Platform approach can transform HIV programming, reminding us that effective service delivery is not just about what we offer, but who delivers it and how much trust it inspires. It's now my pleasure to introduce Ms. Maria Stacey, consultant with the South to South Learning Network. Maria is an independent consultant from South Africa with extensive experience in key population program management, including with the sex worker organization SWEAT and Global Fund principal recipient NACOSA. She specializes in HIV, SRHR, human rights, and gender equality, and supports community-led responses through research, facilitation, advocacy, and organizational strengthening. She also advises the African Sex Worker Alliance and several national key population-led organizations across sub-Saharan Africa. Maria led the development of the new guide titled How to Implement Programs for Young Women Who Sell Sex. This guide fills a major gap in our global HIV response, offering practical, field-tested guidance on how to design, adapt, and integrate services for young women who sell sex, a group that is too often overlooked by both sex worker and adolescent girls and young women programs. So Maria, the floor is yours.
Thank you so much, Suad, and thank you, Matteo, for your brilliant presentation earlier, especially the last two slides. I really loved them, especially the part that showed the non-negotiables of the enabling environment, community-led responses, community system strengthening, even in these very constrained funding landscape that we find ourselves. So onto the implementation guide for young women who sell sex. YWSS, as we call them, are amongst the most vulnerable. I'm going to switch my video off to save bandwidth. YWS are amongst the most vulnerable, yet the least visible populations, especially in the sub-Saharan Africa HIV landscape. So I'm going to take you through these guidelines today and explain why they are so urgent, who YWSS are, and how programs can be practically adapted, existing programs, to reach YWSS in an efficient and ethical way. So the starting point for this guideline is what a lot of us have observed, I think, over the years, is that YWSS have long fallen between existing programs. So on the one side, we have adolescent girl and young women programs, and on the other side, we have sex worker programs. But many young women who sell or exchange sex don't fit neatly into either program. Some are too young to be included in sex worker programs, or they don't identify as sex workers, or they don't associate with sex workers. They may be online, or they may be operating in tertiary education environments and don't really mix with sex worker communities. So they're often missed altogether. And this guideline fills this gap and offers a practical framework to help countries adapt their existing programs, not create new ones, and ensure that YWSS are recognized, protected, and reached with comprehensive services. But why is this work especially critical now when the global HIV response faces such uncertainty? Next slide, please. So we all know that we're in a very uncertain time in terms of funding, and donor cuts have threatened key and vulnerable population HIV services. So this guide argues that a precision focus on populations with the highest incidence and prevalence, like YWSS, is both a strategic and an economic and an epidemiological imperative. When resources are tight, investing where infections are most concentrated yields the greatest epidemiological impact. And what we also want to argue, and what we show in these guidelines, is that these approaches are not expensive. They build on existing systems. By adapting sex worker and AGYW programs, rather than starting new ones, countries can ensure continued coverage at a low incremental cost. So who are these young women that we are talking about? Let's go to the next slide. So YWSS are young women engaged in consensual sexual exchange. We are not talking about victims of human trafficking or sexual exploitation. We're talking about three overlapping groups: sex workers, AGYW, and people, adolescent girls and young women engaged in transactional sex. Now, we're treating them here as separate categories, but I think all of us know that the boundaries between these different categories can be very fluid, and it can be very hard to draw the line as to where the one stops and the other one begins. People can move between different categories at different times. Even at the same time, they can be positioned, they can be both, you know, a sex worker and involved in an intimate partner relationship, or involved in transactional sex. The critical point to think about is the age definition. And this can vary by country, and we really invite countries to make their own decisions on this. Kenya defines YWSS as age 15 to 24. But as you can well imagine, that age 15 to 18 is the group where there may be some discrepancies from country to country. Is there another slide before this one? Let's check. Yes. So why have YWSS been underserved? So there's a variety of barriers, and Matteo's already mentioned many of them. We have criminalisation of sex work in almost all of our countries. We have consent laws regarding age of consent to have sex and age of consent to access sexual and reproductive health services. We have stigma, discrimination, moral judgment, lack of youth competent or non-discriminatory services. We have the fact that many people are engaging in transactional sex are doing so in a very stealthy way. We have these rigid program silos which exclude those who don't fit. And then we have other risk factors like poverty, mobility, gender-based violence. We can also add substance abuse to another one of the drivers. But we specifically in this guide wanted to talk about the issue of minors who sell sex. And so in many countries, in most countries actually, they are classified as victims of exploitation. But excluding them from services actually does more harm. And the Convention on the Rights of the Child obliges us to act in the child's best interests, to protect and care, not to punish. So in some countries, how they've got around this issue is recognizing mature or emancipated minors who can consent to sexual and reproductive health services. And this flexibility should be used to ensure access. So next slide, what does this guideline actually offer? So the guideline has just come back from the designer, and it looks really beautiful. And it's a practical roadmap for inclusion, efficiency, and impact. And it's informed by the WHO guidelines that Matteo was talking about, GPC guidance, and indeed, we've aligned it with the Trusted Access Platform guidance that is just coming out. So it includes how to map, young women who sell sex, including online, service design and planning guidance, ethical decision-making for healthcare workers, guidance on meaningful participation, community mobilization, and leadership development for YWSS. We address some of the costing and sustainability considerations. And again, I want to emphasize that these programs do not need to be very expensive. They are, as you'll see from the examples that are coming up, they work best when they are add-ons to existing programs. We include some monitoring and evaluation considerations, including the role of community-led monitoring, and there's case studies and templates for immediate use. Next slide. This is the second last slide. Just two quick examples, one from Kenya and one from Zimbabwe. And in Kenya, the sex worker program was adapted, and in Zimbabwe, the AGYW program was adapted. So you can come at it from either angle. In Kenya, the sex worker program started consulting with YWSS and engaging them in design, started mapping where YWSS are congregating, including online as well as physical locations. The drop-in center for adult sex workers was expanded to provide access to YWSS age 15 to 24. Peer educators were recruited that were often near peers, so very close to YWSS in age. They were trained in micro-planning. Healthcare workers were trained so that they could provide more sensitized services. And because everything happened in the same facility with a lot of the same staff, the costs were kept low. And this project resulted in higher HIV knowledge, more clinic visits, higher PrEP uptake, and improved linkage to care. And then in Zimbabwe, the DREAMS program identified that there were some AGYW who were selling sex and that they weren't really providing for their needs. So they developed strategies to identify and reach them, again, by recruiting peer educators who were also YWSS themselves. And they linked the YWSS to HIV services, GBV services, and social protection. They developed interactive group sessions, and we have a link to this in the guidance, the manual for these interactive group sessions called the Girls Club. And I really recommend that everybody has a look because it's a fantastic manual. And they also allowed mature minor consent, which enabled them to provide them with confidential services. And they found that this dramatically increased access and retention for these hidden subgroups. Last slide. This is the last one. So just in conclusion, it's a matter of equity, efficiency, and ethics that we actually reach YWSS. And now in the midst of this funding crisis, even more than ever, precision focus maximizes impact where the incidence is highest. And community-led data-driven adaptation is the way forward. The guidelines will very soon be available on the SSLN I2I website. And I want to encourage everybody listening and participating in this webinar to think about what practical steps could existing programs in your countries take to identify and include YWSS. Thank you very much. Over to you, Swad.
Thank you very much, Maria, for this important presentation. It reminds us that evidence-based guidance and meaningful youth engagement must go hand in hand for prevention programs to succeed. So it's really a valuable resource for all of us, and congratulations to the SSLN and partners for this important contribution. We will now move to the third session, where we will hear directly from country representatives, community leaders, and partners who are implementing innovative and sustainable service delivery models for young populations. I'm pleased to hand over to our facilitator for this session, Heather Marie Schmidt. Heather Marie is the advisor for HIV prevention program implementation, jointly working on the Global HIV Prevention Coalition within the UNAIDS prevention team and the HIV testing prevention and populations team at WHO's Global HIV, TB, Hepatitis, and STI program in Geneva. She will guide us through a lively panel discussion with our speakers. So Heather Marie, over to you.
Thank you so much, Suad, and hello, everybody. Welcome to our panel discussion. Can I ask our amazing panelists to turn on your cameras so that everybody can see your beautiful faces? Wonderful. So let me introduce our panelists before I start asking them questions. Our first panelist is Roger Anthony Granacino Abril, who is currently studying clinical psychology at la Universidad de las Americas in Ecuador. He is a social activist and human rights advocate focused on mental health, HIV, youth empowerment, and LGBTIQ plus populations, and an active member of organizations such as MOV HIV Izate. I'm sorry, I definitely butchered the pronunciation of that one. Youth Positives of Latin America and the Caribbean, the Citizen Health Council, and LAC Youth Network, promoting youth participation, inclusion, and community strengthening. And his work bridges academic knowledge and social advocacy, aiming to build more empathetic, healthy, and discrimination-free communities. On the panel, and hopefully they will be able to turn on their cameras soon, we have Sally Henry Bengo from Yoswa, Kenya. Sally Henry is a radical feminist, gay sex worker, and human rights defender working with the KNESWO feminist initiative supporting refugees, migrants, and stateless sex workers in all their diversities in Kenya. We also have Dr. Fren Nanapuku, who is the technical lead for HIV prevention at the Ghana AIDS Commission. Welcome. And finally, but last but not least, Matteo Casalato, who works at the Global Fund to Fight HIV, AIDS, tuberculosis, and malaria as a key populations technical advisor. Before that, he covered similar roles in the Italian Development Cooperation Agency and other international organizations. He is passionate about supporting communities, engagement in HIV, and wider health responses so that we can ensure that truly no one is left behind. So with all of that, we have some very distinguished and relevant panelists. I'm going to start with the first question, and this is to you, Roger. What priorities should government and donors consider when designing, implementing, and funding programs with young key populations?
I should have made a number here, 5.6, and I think it was a mistake. You get it. Well, we have cancelled that with TS7.
Sorry, Dr. Poco, I think you are supposed to be
Oh,
on mute.
thank you. Oh, sorry. The question is directed to me, right? I didn't
No,
hear.
it was directed to Roger first.
Ok, hola, ¿me pueden escuchar bien?
Yes.
Hola, ¿me escuchan tal vez?
Steve.
Ok, gracias. Bueno, gracias por la presentación. Mi nombre es Roger Granizo, yo soy de Ecuador. Y respondiendo brevemente a esta pregunta de cuáles serían las prioridades que deberían considerar los gobiernos y los donantes para diseñar e implementar estos programas para jóvenes, pero primero, identificar que los proyectos que se hagan para jóvenes tienen que ser con jóvenes, ¿sí? Nada sin nosotros. Entonces, es importante que la participación significativa de las poblaciones jóvenes, poblaciones clave o poblaciones viviendo con VIH, puedan tener acceso a estos espacios de toma de decisiones y participación activa para la implementación o creación de políticas públicas para los estados, no solo en Ecuador, sino en toda la América Latina y el Caribe y en todos los países. También propiciar o garantizar la accesibilidad para las poblaciones jóvenes con interseccionalidades específicas como, por ejemplo, poblaciones claves con discapacidad, poblaciones claves en situación de movilidad humana, en situación de conflicto armado. Entonces, una de las cosas que considero que es muy importante que los gobiernos tienen que tomar en cuenta es que las poblaciones clave o las poblaciones jóvenes son la base para poder crear estos espacios que garanticen los derechos, no solo para esta población, sino para todos aquellos que necesitan estos recursos. Y es también muy importante, creo que resaltar el hecho de que las infancias también deben ser actores importantes y claves de estos espacios. Considerar, por ejemplo, a todas las interseccionalidades, como personas afro, personas racializadas, poblaciones racializadas, personas que viven con VIH, personas de movilidad humana, mujeres. Entonces, cuando los financiadores o los gobiernos de turno de cada país toman en cuenta a estas poblaciones para la creación de espacios libres, seguros y accesibles, están garantizando el acceso a los derechos humanos, no solo garantizándonos, sino también visibilizándolos, mostrando la importancia de nuestra participación activa en estos lugares. Y así logramos el empoderamiento de poblaciones tanto en zonas rurales, sí, que están muy alejadas de las cabeceras de las ciudades más grandes, como por ejemplo las capitales. Entonces, estos espacios seguros e inclusivos se generan si es que los gobiernos o los financiadores empiezan a integrar y a tener una mirada mucho más amplia em, de todas las poblaciones que están a su alrededor, ¿sí? O sea, es decir, los gobiernos tienen que empezar a ver que no solo hay una población específica, que en este caso son blancos, heterosexuales, sino que también hay un montón de poblaciones que históricamente han sido vulneradas y debemos o tienen que ser consideradas porque es parte de nuestro derecho, es parte de nuestro acceso, el poder ser integrados, participar para la toma de decisiones en políticas o en acciones que nos van también a beneficiar a nosotros. No sé si ahí está. Oh.
Thank you very much. I think some of the things that really struck me in your response were around the intersectionalities and ensuring the broad representation of young people and young key populations, not just as one kind of group, but in a diversity, and making sure that that visibility is there. So thank you for highlighting that. The next question is for you, Dr. Poku. How is Ghana ensuring that young key populations are prioritized within the national HIV response?
Right. Thanks so much for the question. Yes, in Ghana, young key populations are prioritized in the response. In fact, when we look at our IBBSS that was conducted, even among men who have sex with men, in fact, 62% were identified as young people. So they are key, important population that we have to deal with. And in our programs, we ensure that they are well catered for and targeted. Hitherto, we were doing general prevention and general services interventions for all the key populations without specifically targeting the youth as it is, the young key populations. But in a couple of months back, starting last year, we have started targeting specifically the young people who are key populations. We have specific programs for them. And these programs are being implemented by prominent civil society organizations who have created what we are terming trusted access platforms. These platforms cut across all the sectors, both the health sector and the civil society organizations that are providing the services. So there are specific facilities where access is granted for services to be received, whether it be ARVs, whether it be HIV testing services, whether it be counseling. And in fact, they have included mental health into our service provision protocols and service provision categories. So we are giving comprehensive combined models of service delivery for key populations, especially the youth in current times. We have designed programs for them. So the though in a few months ago, the environment had not been too conducive, we still ensure that the service provision is ongoing for key population. And there are several adaptations that have been done, both by the providers, the civil society organizations, and even in the health service providers as well.
Thank you, Dr. Puku. That's amazing. So in Ghana, that recent change, I mean, obviously, we'll be really interested to see what happens and what the results are. But one of the things that struck me is very much around including that comprehensive combined model of care. So something that I've heard come up in other forums is from young people themselves is very much a desire for mental health to be included within that comprehensive care as one of the key asks. So that's amazing that Ghana is really out there at the forefront of this. And also hearing that, you know, the really redesigning how it's being delivered and what the programs are for the needs and preferences of young people and young key populations. Thank you for enlightening us about what Ghana is doing. The next question is for Matteo. Now, Matteo, considering the global funding changes that have impacted key population programming, and particularly population programming for young key populations, how is the Global Fund ensuring that young key populations remain a priority?
Thank you, Adamarie, for the question. Again, a pleasure to be here with you and to represent the Global Fund here. Again, my name is Matteo, and I work at the Global Fund as a KP advisor. Well, first of all, let me say that young key populations are and remain a big priority for the Global Fund in the context of key populations programs. I also wanted to say maybe that the way we think about the young population is really a very, very comprehensive one, meaning that we try to acknowledge as much as possible how adolescence and in being young really is a time when people change rapidly and their needs change rapidly, and maybe even the labels and tags that we use when we program for key populations at times might be or might feel a bit tight, right? So I think that also wanted to reassure along what I think Roger was talking about, right? Trying as much as possible not to compartmentalize people. We're trying to really ensure that programming thinks along these lines as well. Now, in terms of priorities for us and how we hope, and we really hope that the financial situation will allow us to continue to do so. In terms of priorities for young populations, there are three things I think I would like to talk about. One is continuing ensuring access to services for young populations. This means, in terms of service delivery, that we enable as much as possible community-led models where you have a peer that reaches out to a peer, so a young population reaches out to a young KP peer, but also that we continue working with all of the organizations at the community level, but also the national level, to create more enabling environments, right? And it's about those laws that restrict access to services in terms of criminalization for key populations and young key populations, but also working around those laws that can enable, for instance, earlier access to services. So for instance, lowering the age of consent, or even acting on those gender norms that at times affect a lot of young women from key populations. I guess the second aspect that is really, really important at the Global Fund is also working on the community engagement side of things. And when I talk about that, in terms of Global Fund, I'm speaking to the strategic initiative on community engagement that a lot of you, I'm sure know. It comes with different components. There's an important component around long-term technical assistance and capacity building. In that, we actively work with Y+, the global network of young people living with HIV, but also with the Asia Pacific network of young populations, and a number of other networks of young KPs, to ensure that they can themselves then provide support to more local organizations that are youth-led. Another important mechanism that I think it's important that the Global Fund we have created is the Youth Council, that since 2020 is an advisory body directly to the executive director of the Global Fund, as a mechanism to bring to the highest level of decision making within the Global Fund the voices and the needs of young key populations. Now, a third element and a third priority that I want to talk about is one around building the leadership of young key populations, building also the capacity of youth-led organizations. How do we do that? Well, there are different experiences. Of course, we do that via the grants, via specific channels to build the capacity of organizations. I'm thinking in GC7, for instance, we spent quite some resources on something we called community polls, which is a whole assessment of capacities for grassroots organizations so that they can, access technical assistance that hopefully can bring them to a level that they can apply to global fund, implementation mechanisms at country level. And also one last thing, maybe the Her Voice Fund, another great initiative that is funded by the Global Fund alongside Viv Healthcare and is entirely managed by Y+, which is active in a number of countries to provide specific services to young populations, but particularly around building advocacy skills in young leaders, building their capacities, and building also their ability to grow as organizations themselves. Maybe I'll stop here. Hope that's a bit of a run through things that we think are really important going forward too. Thanks.
Thank you so much, Matteo. And I think I can speak on behalf of everybody on this call that, we're grateful for Global Fund continuing to champion key populations and young key populations. We hope that continues in GC8 in a big way. But very much, they're focusing on things like enabling environments are not popular or necessarily sexy for a lot of donors. This is something that's really important, that there are big donors who continue to focus on this, and as well as building capacity of our youth leaders and, where they are now in various countries. So this is really great. We have had a couple of questions in the chat, in the Q&A. And so I wonder if I can ask my amazing panelists if they would like to weigh in on those. Now, for anybody who hasn't seen them, there was one question on harm reduction for young people. And so this question was, why are there no integrated harm reduction programs for AGYW who are using drugs and other communities of young key populations? So, really those young key population, young people who inject drugs, where are the programs? And I know that Matteo has already put in an answer, but what I might do, Matteo, get you to summarize your answer. But before I do that, ask Roger if you would like to weigh in.
Claro que sí, muchas gracias por la pregunta. A ver, esto de reducción de daños en jóvenes, primero creo que hay que dejar de verlo con una perspectiva biomédica o médica y punitiva también, y hay que empezar a abordarlo desde una mirada mucho más integral de derechos humanos y salud mental. Creo que uno de los problemas más grandes que América Latina o el mundo, al menos Occidente, donde puedo hablar, tiene es que normalmente siempre responsabiliza a las poblaciones afectadas por ejemplo, VIH, ITS, salud mental, porque normalmente los estados hacen eso, responsabilizar a la población que está afectada para mostrarle a la población que no está infectada o que no está afectada por una patología lo que no tienen que hacer. Sí, es decir, a veces a las personas que vivimos con VIH jóvenes nos ponen como ejemplo para esto de la prevención, pero es más desde una mirada de miedo, ¿sí? Es decir, mira, esta persona vive con VIH, tienes que cuidarte, a menos de que quieras ser como él. Entonces, ¿cachan? Es como uno de los problemas muy grandes de esto de la reducción de daños, primero es porque está visto desde una mirada tan biomédica y responsabiliza tanto a las poblaciones que no tiene este enfoque de garantizar accesos integrales tanto para prevención, sí, es decir, si una persona joven quiere tener relaciones sexuales sin condón por varios motivos, sí, que al menos los estados le garanticen a esta persona recursos necesarios para que pueda al menos tener una opción Si es que, digamos, quiere tener relaciones sexuales sin condón, perfecto, tenemos PrEP, ¿ok? Tenemos otros insumos, perfecto. Tuviste sexo sin condón y tienes la preocupación de que hay alguna ITS o VIH, perfecto, tenemos estas profilaxis. Entonces es ir jugando, ir tanteando o conociendo cuáles son estas herramientas. Entonces, creo que los programas de reducción de daños deben reconocer que las y los jóvenes experimentan contextos de vulnerabilidad distintos, ¿sí? Y que la respuesta no debe ser el castigo, ¿sí? Ni en una base moral, sino con el acompañamiento, la formación clara y el acceso a los servicios seguros y sin discriminación. Porque uno de los problemas más grandes que como joven he visto viviendo con VIH y trabajando en activismos en la región es que normalmente ir a un médico, a una consulta médica por una ITS siempre produce vergüenza, produce miedo, estamos todo el tiempo con este pensamiento de nos van a juzgar, me van a juzgar por esto, cuando no debe ser así. Irte a un médico, un joven, ir a un centro de salud por cualquier atención que tenga, tiene que ser igual de sencillo que ir por un dolor de garganta o por un dolor de cabeza. Sí, entonces yo considero desde mi experiencia que una de las formas más grandes para reducir los daños, sí, en poblaciones jóvenes, primero es reconocer que las poblaciones jóvenes no son responsables de las situaciones externas que viven, pero que también es importante que las poblaciones jóvenes nos empoderemos para que podamos tener mejores accesos a información y empujarle u obligarle a los estados a que nos den esta información accesible, pero también amigable, porque no solo es tener información biomédica con muchos tecnicismos, sino también es muy importante que esta información sea amigable para todas las poblaciones, es decir, poblaciones con discapacidad jóvenes, que era lo que hablaba de las interseccionalidades. Una de las formas para reducir los daños o reparar estos daños es reconocer las interseccionalidades y todas las vivencias que las juventudes viven. Reconocer que el dolor que una juventud está viviendo porque el Estado o el gobierno no le garantiza acceso a los antirretrovirales porque se tiene que movilizar de 5 horas. Porque vive en ruralidad, muy adentro en una comunidad y el hospital está muy lejos y no tiene acceso a poder salir de esa comunidad todo el tiempo. Entonces, es importante ver esto y dimensionar que cada población con interseccionalidad vive una distinta realidad, ¿ok? Y que tenemos que identificar, aunque sea solo una persona que viva una interseccionalidad distinta, esa persona merece tener un acceso libre. Entonces, como les mencionaba, creo que desde mi experiencia las estrategias más efectivas en la organización con la que trabajo en el Ecuador, que se llama Movilízate, que es una organización de jóvenes que vivimos y conviven con VIH, creo que ha sido construir, sí, estos espacios conjunto con jóvenes, es decir, jóvenes que vivimos con VIH, jóvenes que no viven con VIH, poblaciones clave, unir en estos espacios y conversar, tener este diálogo y estos consensos grupales y decir, ok, miren Estado, miren gobierno, nosotros como jóvenes necesitamos esto porque no se está garantizando esto para nuestros servicios de salud gratuitos e integrales. Entonces creo que es muy importante verlo desde esta manera, primero para proteger la vida, la salud y la dignidad, porque como poblaciones, la población joven es una de las poblaciones más discriminadas y violentadas históricamente también, y ahora sumándole todas las interseccionalidades que vivimos, nosotros estructuralmente todo el tiempo estamos luchando para poder deconstruirnos nosotros, pero también para hacer que todo nuestro ambiente, todos nuestros espacios culturales y compartidos con otras personas puedan ser seguros. ¿Sí? Entonces, como para terminar esto, creo que viéndolo de reducción de daños, primero es reconocer que las poblaciones jóvenes viven interseccionalidades diferentes, que debe garantizarse, ¿sí? Una atención individual, una atención accesible, asequible, con base de derechos humanos y también que las juventudes son este motor para poder crear espacios para las siguientes generaciones de jóvenes. Gracias.
Muchas gracias for such a great and comprehensive response. Thank you. Now I'm going to open it up to our other panelists, Matteo and Dr. Poco, if you would like to also comment on this question.
Right. Thank you so much. Yes, harm reduction is very, very important in the scheme of things when it comes to key population programming. And in Ghana, we privilege that in the past few years, 2 years or so, we have initiated harm reduction as one of our key elements of interventions for the key populations. We have started harm reduction program across the country. Though we have not gone scale-wide, we have very good programs being implemented by WAPCAS, one of our civil society organizations in Ghana. And also, we are currently developing an implementation guide for harm reduction. And as I speak, the LI for harm reduction is being drafted, yet to get to cabinet for approval. So there are a lot of good things happening in the area of harm reduction, where we currently will see drug use as a public health issue, not really as a criminal issue as it is. So this is a very important occurrence in Ghana. We are also developing an implementation guide, as I said, to guide implementers on how to effectively implement harm reduction programs. We are hopeful that before the end of the year, we'll have this document out. This is being supported by the Global Fund through, again, our civil society, and there's a strong collaboration with the government, the Ministry of Health, the National AIDS Control Program, and the Ghana AIDS Commission. And there is also a steering committee or implementation technical working group to oversee the implementation of harm reduction program in the country. Thank you so much. And we are hoping that in a couple of months, this will be well established and other countries might even come to learn and study how we are doing our harm reduction program in the country. Thank you.
Thank you. And I think I can speak on behalf of everybody that when you do have these documents and plans and strategies available, I think others would really love to see what Ghana is doing. So we look forward to seeing them.
All right. Thank you.
And so next over to you, Matteo. I know that you wanted to really comment on this.
Yeah, thank you. Because no, thank you, Marie. Yeah, I really thought when I read it that Juma's question is really on point there, because it really does point to, one of the gaps that we see when we look at, national KP programs, both, implemented, by, PR1, like your ministries of health, but also by, community organizations, your PR2, if you like. And particularly, we noticed that, harm reduction services thought around the needs of women and including, young women are often missing. Or it's but a bit of a partial approach. So one of the efforts that we are making is trying to signal these gaps when we see them, and trying also to ensure that there's a number of interventions that are specifically planned around that. I think that in terms of the questions, why HYW programs, why KP programs, and we're not doing that. I believe that one of the key answers, one of the ones that we can propose at least, is one that speaks to person-centered care as much as possible. As I said, initially, and as I think Roger was also saying, trying to stay away as much as possible from, boxing people in particular categories, in particular groups, where you basically come with, imagine them with a set number of needs, and without giving room for different needs or different behaviors, and therefore for different services to be provided. It's really important as much as possible, understanding that there are implementation arrangements, that there are organizations that have been doing things in a certain way for a number of years, but trying to challenge also these ways of doing around, acknowledging people's needs. So I think when it comes to planning KP programs, on one side is speaking to the HYW programs, making sure that those who implement and deliver services look at service users as complex entities that are and people that are evolving every day, that might be thinking about using drugs tomorrow, and so therefore what are the needs and and services that we can provide in that specific sense. And when resources are not there, because we have to admit that we are facing a funding crisis, so maybe the package of services won't be able to be enormous and include everything. Then if we can't provide those services, how do we make those necessary linkages to other providers to ensure that we address those needs in a different ways, maybe innovation with in a sustainable manner too. I just want to stop here. Hope that's enough. Thank you.
Thank you, Matteo. I think across the board, some of the things that really came out is recognizing intersectionality. None of us fit into a neat little box, and we can only be in that box. And we need to stop doing our programming in that way. And there's so much opportunity for innovation and so many opportunities with involving and making sure that young people, young key populations are in the driving seat to let us know how and what they need, and that we don't leave people behind. So I have one question that I want to ask everybody on the panel, and this is, in one sentence, what is one thing that you want everybody on today's webinar to know about programs for young key populations? Who would like to start?
All
I
right.
can start
So
if you like. Oh, go ahead. Go ahead.
please go ahead. After you then.
Thank you, Dr. Nana Porco. I go first then. No, I mean, I'm just going to repeat myself in a way, but it's really about trying to not as much as possible label people or imagine that, they belong to a specific group, really trying to, as much as possible, think in terms of person-centered care. And within that, a specific shout out to mental health services. I do think that, psychosocial counseling and mental health services are often neglected in service packages, and we need to find ways to provide it in an effective, cost-effective way and also sustainable one. Thank you.
Thank you.
Thank you so much. I think programming for young people, especially young key populations, is very critical that we ensure that they are included in the decision-making in processes, because participation is key if we want to really get the most out of them and also be able to reach them the way we want to. We also want to ensure that there's confidentiality in the programming. They face double stigma, double discriminatory attitudes. And so if they are not confident, we don't create the trusted access platforms for them, it's going to be a hell of a problem. As I said, in Ghana, we've been able to do that effectively because the civil society organization working with KPs, they are their friends. In fact, some of the KPs have developed within the organization to become leaders and of some of the areas and some of the sections. So they are their friends, and they trust them, and they work very closely with them. And we've been able to create a similar platform within the health facilities where health services are also received, and the linkages are very strong. So we should ensure that the networks of the young people are established and they talk to each other with established collaboration with the ministries and the government agencies. Thank you, and over.
Great. That's good advice.
¿Puedo ir yo? Sí,
Sí.
perfecto. Bueno, súper corto. Para las juventudes, para mis pares, no están solos, no están solas, no están soles, ¿sí? El poder más grande que tenemos es saber que somos jóvenes. Y mientras lo seamos, podemos luchar, podemos gritar y podemos empujar por nuestros derechos y por los derechos de las juventudes que vendrán, por los que ya defendieron estos derechos y sobre todo que se lleven que nunca van a estar solos si están acompañados de algún par. Desde América Latina y el Caribe tienen a la red de jóvenes positives de América Latina y el Caribe hispano, J más LAC, a la red juvenil LAC, a Movilízate, y que si ustedes en algún punto de su vida sienten que el mundo les está acabando, les está opacando, recuerden que su fuerza viene del deseo de que todos nosotros podamos estar algún día o en algún momento felices y podamos convivir sin sentirnos discriminados o violentados.
Wonderful words to end on, and to end our panel discussion. Before we end our panel discussion, I want to invite also, because we have had some questions in the Q&A, I wonder if Maria Stacey is able to join our panel just for one to answer one of the questions as well. Amazing. And so for everybody who can't see the chat, the question is around interventions being implemented for young female sex workers in settings where there is criminalisation. And so the challenges there, and how do you overcome some of the challenges? So Maria's provided very comprehensive responses in the chat, in the Q&A. I recommend that you read those, but could you summarize your responses, please?
Sure, and thank you for inviting me to speak about this issue, because I come from a program implementation background, and this is something that we've always been really concerned about. I'm going to speak about the South African experience because I think our situation is similar to some other countries, that we have it's mandatory for healthcare workers to report minors who are selling sex, either to the Department of Social Development or to the police. Now, we know the history of sex workers being harassed and violated by the police. So, you know, this really is something which just drives minors selling sex further underground. And I think this, you know, the mandatory reporting is designed to protect minors who are sexually exploited. But there are many young people selling sex who are mature minors or emancipated minors who, even though they're in highly vulnerable situations, will tell you that they are selling sex voluntarily. They're highly at risk, and yet there's so many barriers to reaching them, mandatory barriers. So what I said in the chat, I feel very strongly that our policies need to start being more responsive to this reality, that there are people, minors, selling sex. And at the moment, the responses are not adequate to reach them and are just driving them further underground. Thank you very much.
Thank you. And I think that is a really important consideration to make sure that we're thinking about this going forward, but also this real world example of where it's really causing harm, and the importance of overcoming criminalization, but really around continued investment and advocacy around enabling environments. And so with that, I think I can probably close the panel. Please join me in a thunderous round of applause for our panelists, Roger, Dr. Poku, and Matteo, who provided their expertise and their insights, amazing responses, and gave me a lot to think about personally. And thank you. And also to Maria, who joined to answer our questions as well. Over to you, my amazing colleague, Suad.
Thank you to all our panelists and to the audience for such an engaging discussion. Now I would like to hear your reflections through a short Mentimeter activity. There would be a link in the chat box. Please click on that link and answer this simple question. What is one takeaway from today's discussion that you would like to prioritize in your country or organization's work? What is one takeaway from today's discussion that you would like to prioritize in your country or organization's work? We'll take a minute to see your responses appear on screen. And please feel free to share your feedback in your native language. We really want to capture everybody's views. And so don't worry if English or French is not your first language. Your input is valuable in whichever language you choose to write. So yes, please let the results come in. So we have one response: community participation is key. Young key populations have to be at the center of any response, of course. There needs to be increased agility built into programs to ensure that young people in all their diversity receive the services they need when they need them. Yes, excellent. Okay, I will not be able to read this Spanish, but yes. Young key populations have been invisible for very long. We have to prioritize and fund interventions to address the risk and vulnerabilities. Yes. Ensuring that communities are advocating for packages that meet their needs, even when there are constrained resources. Anyone else would like to suggest what? Yes, intersectionality of young key population services, yes. There is need for adolescent schools and young women programs to deliberately target young women who sell sex. The Trump freeze on key populations work has also affected young key populations work, hence on a need to document that, definitely. We need to tailor programs to address the needs and priorities of young key populations. Funding cut cannot be an excuse. Yes, definitely. I see, Heather Marie, you've raised your hand.
A very bad translation of the Spanish, so apologies to native Spanish speakers because I will butcher it. But I believe it said, young people are not alone. While young people fight, we have hope.
Excellent. Thanks so much, Heather Marie. We have also providing services to the young key populations that will meet their need best irrespective of the legal environment. Community and engagement and enabling environments are non-negotiables. Thank you. Yes, so I think these are all very thoughtful contributions. It's really inspiring to see the diversity of priorities emerging from this group. I think we are now coming to the end of today's community of practice, so we can briefly summarize the key messages as like HIV prevention for young key populations must remain a priority within national responses. Integration with broader youth and key population programs is both possible and already happening in several countries. The meaningful engagement of young people, not as beneficiaries, but as partners, as leaders, is essential for sustainability. In the current funding environment, we must collectively advocate for and invest in programs that protect and empower the next generation. And of course, investing in innovations safeguards sustainability, allowing countries to do more with limited resources and adapt to the changing epidemics and contexts. We also spoke about intersectionality and also the importance that we have different sectors, the health, not only health, education sector, social sector, women's sector, justice, all contributing together to improving the life of young key populations. I encourage everyone here to take one idea forward, whether it's strengthening community-led mechanisms, ensuring that youth voices are represented in program design, or adapting your services to be more inclusive and user-friendly. And together we can make these lessons real in our national context and keep prevention at the heart of our collective HIV response. So before we close, just a few next steps. Please look out for the upcoming release of the document, Planning and Managing HIV Programs with Key Populations. It will soon be available on the GPC website, and we will notify you by email once it's published. We will also be reaching out to everyone who has participated in the Key Populations Community of Practice through 2024 and 2025 to gather your feedback and reflections, and your input will be really invaluable in shaping the future direction of the Community of Practice in 2026. So let's stay connected through this community of practice, continue sharing and support one another as we work toward a future where every young person, regardless of who they are or where they live, can access the service they need safely and with dignity. So thanks everyone and goodbye.